You are a Pediatric Intensive Care Unit, PICU, resident on duty. A 6-year-old child, Lily, is admitted with septic shock and thrombocytopenia. Lily is not actively bleeding, but has an upcoming central venous catheter, CVEC, placement. The attending physician asks if platelet transfusion is required before the procedure.
Question 1. Should Lily receive a platelet transfusion before the CVC placement? A. Yes, because her platelet count is below normal. B. No, because she is not actively bleeding. C. Yes, because her platelet count is below 5,000 pounds on L and an invasive procedure is planned. D. No, because platelet transfusion should only be given if the count is below 1,000 pounds Celsius.
Correct answer, C. Yes, because her platelet count is below 5,000 L, and an invasive procedure is planned. Prophylactic platelet transfusions are indicated when platelet count is 5,000 tons is for invasive procedures. Guidelines recommend 5,000 for general surgery, invasive procedures, and 100,000 Celsius for critical site surgeries, e.g., neurosurgery, ocular surgery. If Lily were not undergoing an invasive procedure and had no active bleeding, transfusion would not be necessary at this platelet count.
Lily undergoes a successful CVC placement without complications. However, 8 hours later, she develops active gastrointestinal bleeding. Repeat platelet count 18,000 L.
Question 2. What is the best course of action? A. Transfuse platelets immediately. B. Administer desmopressin, DDAVP, instead of platelets. C. Monitor closely and only transfuse if platelets fall below 100,000 pounds cc. Wait for further coagulation tests before deciding.
Correct answer, A. Transfuse platelets immediately. Therapeutic platelet transfusions are indicated in actively bleeding patients with a platelet count 20 to 5,000 L. The appropriate threshold depends on the severity and location of bleeding. DDAVP is used for qualitative platelet defects, not thrombocytopenia. Waiting is not an option, as active bleeding at this level requires immediate platelet support.
Lily receives a 10 ml platelet transfusion, and her post-transfusion platelet count rises to 48,000 L. However, bleeding continues.
Question 3. What could be the reason for ongoing bleeding despite transfusion? A. Platelet refractoriness due to alloimmunization. B. Incorrect platelet dose. C. The need for ABO identical platelets. D. Delayed transfusion reaction.
Correct answer, A. Platelet refractoriness due to alloimmunization. Platelet refractoriness occurs when patients develop HLA antibodies from previous transfusions, reducing transfusion efficacy. A corrected count increment, CCI, 7,500 post-transfusion suggests platelet refractoriness. Management. Consider HLA-matched or cross-matched platelets in consultation with transfusion services.
The blood bank provides HLA-matched platelets for Lily. Bleeding stops, and her platelet count stabilizes at 75,000 L.
Question 4. What is the next step in Lily's management? A. Continue routine platelet transfusions every 24 hours. B. Monitor platelet count and only transfuse if it falls below 2,000 diacyl. C. Prescribe prophylactic antifibrinolytic therapy. D. Stop platelet monitoring since her bleeding has stopped.
Correct answer, B. Monitor platelet count and only transfuse if it falls below 2,000 has. A. Routine prophylactic platelet transfusions are not recommended unless platelet count 1,000 has. L. In stable patients. For patients with bleeding, platelet count should be maintained 20,000 5,000 L, depending on severity. Continuous unnecessary transfusions increase the risk of alloimmunization and adverse reactions.
Key takeaways. Prophylactic platelet transfusions are used before invasive procedures when platelets 5,000 L. Therapeutic platelet transfusions are used in actively bleeding patients with platelet count 20 to 5,000 RL based on severity. Platelet refractoriness should be suspected if post-transfusion counts do not rise adequately. HLA-matched platelets may be required. Routine platelet transfusion in non-bleeding patients is not recommended unless platelet count is 1,000 L.